How would you rate the Polish healthcare system here?
Rate like in numbers, you mean? Like
Give me a number, 1 to 10. Poor to superior, excellent, awesome, however you'd want to rate it. How would you rate the Polish?
I mean, I can only rate according to the experience of the countries I have lived before, right? So
yes.
I would say superior to Brazil in terms of quality for sure. Yeah, definitely superior.
Compared to America?
In terms of
accessibility, price.
Yeah, superior as well from my experience being there, right? Even though I had health care in States, if I had to do like, I don't know, some visit that was after 7 o'clock or something like that, I would have to end up paying, $150 just for a little check here and there. So
that's one of the things I'm so impressed of here is that I can call at doctors with LuxMed. I have LuxMed private health insurance, and 6 o'clock, I'm not feeling good. Call, hey, we have an appointment for you at 7:30. 7:30 today? Yeah, 7:30. Come on down. Mm-hmm. No problem.
Super easy.
Yeah, accessibility is awesome, I would say.
Super easy. Yeah. In Brazil, even though if you have a healthcare, you need to make an appointment. Maybe you're gonna have to wait for 1 month, and then
if you're ill.
There is emergency and non-emergency, right? So if it's like non-emergency, who knows how long you're gonna have to wait to have your appointment?
Seriously?
Yeah.
Wow.
Yeah.
Okay. That's a yeah. And here it's like maybe with NFZ, do you have public health insurance or private health insurance?
Public.
Yeah. So I know it's like maybe you might have to wait a day for an appointment to get in to see a doctor, but usually it's fairly quickly.
Yeah.
For specialists, though, I hear it's definitely longer. Cardiologist, ophthalmologist.
Yeah, if you need something complicated like, I don't know, like a hip surgery or something like that, it may take a long time.
Couple months, I've heard. And even for an eye doctor, I've definitely heard the wait time is about 2-3 months to go see an eye doctor. So,
but then in something like that, if it happens, that I would just go for a private doctor.
Yeah.
So I'll get the appointment it's not that expensive comparing if I go to a private doctor in States, for example.
Yeah.
So
same with the dentist. I mean, I've gone private to a dentist, and I would say a really deep cavity that will require some hard drilling and filling and sculpting. 250 is what day.
Yeah.
Okay.
In States, that would not even be.
that'd be thousands.
Yeah.
That'd be thousands.
Yeah.
We got quoted for one root canal. It was $2,500 because Monica was uninsured. And it was $2,500. I said, we both agreed it'd be cheaper to fly to Poland, have vacation, get her entire mouth fixed, fly back, then go visit that dentist when you're uninsured. Yeah, and it's not a big deal here. It's so, like things with that are in that realm. I'm just so impressed with that. It's that cheap.
Yeah,
like $250.
Yeah,
that's it.
Yeah,
do my whole mouth, man.
Yeah, when I was living in Portugal, about 2 years ago, we were there for 1 year because Mateus was doing Erasmus program. And there were a lot of people just flying, Portuguese people that lives, for example, in Switzerland or Sweden or whatever. They are flying from those countries back to Portugal just to get those type of cheaper services and good at the same time. Because, it's just cheaper. In Poland, the same. I'm pretty sure there are people that, I know people that, for example, they live in Germany and they fly from there here to get their stuff done. And they go back.
Yeah.
So it just makes more sense.
No, I hear you, definitely. So you gave birth here.
Yeah.
In Poland.
In Tychy.
In Tychy. Which hospital?
Oh, remember? Gosh, I don't know the name, but it's like the hospital where...
Szpital Wojewódzki?
I don't know.
That's where Oliver was born, Szpital Wojewódzki.
Yeah, it's the same hospital where Mateus was born, so...
It's right off of S1, the highway. You take that exit and it's on the left-hand side.
Maybe.
Maybe.
I don't remember.
You're like, I was giving birth, man. I don't know where I was.
Yeah, I don't remember. It was dark. It was in the evening. I barely remember the way.
Trying to get this baby out of my body.
Yeah.
I don't know where I'm being taken.
Yeah, but it was in Tehe, and it was a okay experience. Was good.
So talk to us about the care you received, if you remember,
Mm-hmm.
during birth, but mainly I'm really concerned about the aftercare of mother-child care.
I was going to a doctor in Tehe, and I told him in the beginning that, I want to have a more natural birth as much as possible. So he recommended me this hospital in Tehe that was good. We had some classes in the afternoon in this hospital from the nurses on like what to expect during the pregnancy, how to do after, and all those newborn cares and everything. And it was pretty cool, was free, and was like it was nice. The experience of giving birth in the hospital was very positive. I felt supported, and even though I couldn't communicate at all in English with them, with the nurses, Mateus was was allowed to be with me all the time, and that is something that usually in Brazil I don't think is possible to.
I didn't even think about that you don't speak any Polish, and you have Polish nurses taking care of you.
Yeah.
And you can't even communicate with them.
Yeah.
You're going through this life event of giving birth to your child. But yeah, Mateo, I was there for Oliver's birth too. I was around. I was next to Monica.
Yeah, so even though we didn't speak the same language, we couldn't communicate, I felt well supported. The afterbirth, I had to stay 3 days as a rule in the hospital. And the afterbirth, I got like many times a visit from a nurse to check on the baby, to help me to take care of the belly button thing and how to breastfeed, and like it was really cool. I felt like really well supported, like it was very nice.
Did you have the midwife coming to the hospital, coming to your house?
Yeah.
After?
Yeah.
How long did that last? You remember?
She was coming like every week, maybe 4 times.
Yeah.
So the first month.
So it's a month of
Yeah, so she was checking the belly button, checking how to, in the beginning, the breastfeeding, it's complicated, right? Sometimes.
I have no experience with that.
Sometimes it's too much milk production, and then many things happen. Anyway, she was like giving really good tips and how to bath the baby. She bathed him with me, and how to hold, how to put to sleep, how to make comfortable. She was like really giving all her experience, and it was very natural for her, and it was very natural for me too. Even though I didn't know her, I felt like she was a very nice person to be in my house in that moment.
Yeah, I can agree with you there. I was shown how to bathe Oliver, dress him. If he had the colic or the stomach issue, and turn the baby over, pat like this, put the baby on your chest, lay down like this. It's like, I would have never thought about that stuff.
Yeah, and for me it was really important because, all my family is back in Brazil. So I don't have like support from my mother or my grandmother. I don't have their type of wisdom in this subject. They can tell me something on the phone, but they are not there to
physically helping you.
So having this woman from time to time was really helpful. Yeah.
I agree. Yeah, it's such a great thing here, I would say.